If you're managing arthritis and wonder which vitamins might help support your joint health, research suggests 3 specific nutrients worth discussing with your doctor. I'm going to break down the science behind each one, explain how they work in your body, and share what current evidence actually shows about their potential benefits alongside proper medical care. Before we dive in, a quick but important note: this information is educational, not personalized medical advice. Arthritis management should always involve your healthcare provider, and any supplements should be discussed with your doctor first, especially if you're taking medications. Everyone's situation is unique. Does this sound like information you've been searching for? You're dealing with arthritis, looking for evidence-based approaches to support your joint health? Comment joints below so I know you're following along. So here's what's happening in your body when you have arthritis. Your joints experience inflammation and gradual breakdown of cartilage, the protective cushioning between bones. This process involves oxidative stress, where unstable molecules called free radicals damage healthy cells. Your immune system responds, sometimes overreacting and causing more inflammation. That's the cycle we're trying to address. Now, here's where nutrition enters the picture. Certain vitamins play specific roles in reducing inflammation, protecting cells from damage, and supporting the repair processes your body naturally performs. They don't replace anti-inflammatory medications or disease-modifying treatments, but they may complement your existing care plan. The first vitamin we need to talk about is vitamin D. This one gets significant attention in arthritis research for good reason. 2021 analysis published in the journal. Nutrients examined data from multiple studies involving thousands of participants with rheumatoid arthritis. The findings indicated that people with lower vitamin D levels tended to experience more severe disease activity. The researchers noted that adequate vitamin D status appeared to correlate with better inflammatory markers. What's the mechanism here? It acts more like a hormone than a traditional vitamin. It influences over 200 genes in your body, including those that regulate immune function and inflammation. Specifically, it helps modulate T cells, immune cells that can attack your own joints in autoimmune arthritis. When vitamin D binds to receptors on these cells, it may help calm excessive immune responses. Your body produces vitamin D when sunlight hits your skin. But many people, especially those living in northern climates, are spending most time indoors, don't get enough sun exposure for adequate production. Food sources include fatty fish like salmon, fortified dairy products, and egg yolks. But it's difficult to get therapeutic amounts from diet alone. If this information is making sense, and you want more evidence-based health content like this, hit that subscribe button. I share new research-backed approaches every week that can help you have more informed conversations with your healthcare team. The typical supplementation range studied in research is 1,000 to 2,000 IU daily, though some people with significant deficiency may need higher doses initially under medical supervision. Here's the critical part. You need to know your baseline level through blood testing before supplementing. Too much vitamin D can cause problems, including calcium buildup in blood vessels. Your doctor can order a simple 25-hydroxyvitamin D test and determine the right dose for your specific situation. Let's move to the second vitamin. Vitamin C. You probably associate it with immune support and fighting colds. But its role in joint health is equally important. Vitamin C serves as a crucial building block for collagen, the protein that gives structure to your cartilage, tendons, and ligaments. When researchers at the University of South Florida tracked dietary patterns in people with osteoarthritis, they discovered something interesting. Those consuming higher amounts of vitamin C showed slower progression of cartilage loss over time compared to those with lower intake. Here's what happens at the cellular level. Collagen synthesis requires vitamin C as a cofactor, meaning the biochemical reaction simply cannot occur without it. Enzymes that build and repair collagen molecules need vitamin C to function. Without adequate amounts, your body struggles to maintain and regenerate cartilage tissue. Beyond collagen production, vitamin C acts as a powerful antioxidant. Remember those free radicals I mentioned earlier? Vitamin C neutralizes them, potentially reducing oxidative damage in joint tissues. In inflammatory arthritis, oxidative stress contributes significantly to tissue breakdown, so having antioxidant protection matters. You're halfway through, and if you're finding this helpful, let me know with a quick comment. Now here's where most people make a mistake that undermines everything. They assume more is always better with vitamins. That's not how it works. For vitamin C, food sources should be your primary approach. Citrus fruits, strawberries, bell peppers, broccoli, and Brussels sprouts provide vitamin C, along with other beneficial compounds that work synergistically. A varied diet rich in fruits and vegetables typically provides 100 to 200 milligrams daily, enough for basic needs. Supplementation might be helpful if you have documented deficiency or limited dietary intake. Studies typically using 500 to 1,000 milligrams daily. However, very high doses, several thousand milligrams, can cause digestive upset and may increase kidney stone risk in susceptible individuals. The goal is adequacy, not megadoses. The third vitamin that deserves attention is vitamin K2. This one's less discussed, but has emerging evidence for bone and joint health. Vitamin K exists in two main forms. K1, found abundantly in leafy greens and involved primarily in blood clotting, and K2, produced by bacteria and fermented foods, and by gut bacteria, which plays a distinct role in calcium metabolism. Here's why K2 matters for arthritis. Calcium needs to end up in your bones and teeth, not in your soft tissues, blood vessels, or joints. Vitamin K2 activates proteins called matrix GLA proteins that help direct calcium to appropriate locations and prevent it from depositing where it should indeed. In osteoarthritis, abnormal calcium deposits can form in joints, contributing to stiffness and pain. Research published in Osteoarthritis and Cartilage followed participants for several years and found that those with higher dietary vitamin K intake showed reduced cartilage damage and fewer bone changes associated with knee osteoarthritis. The protective effect appeared strongest with K2 specifically. The mechanism involves activating osteogalsin, a protein that helps incorporate calcium into bone matrix, and matrix GLA protein, which prevents soft tissue calcification. Without adequate K2, these proteins remain inactive, like having workers on a construction site without tools. Food sources of K2 include fermented foods like natto, a Japanese fermented soybean product that contains extremely high amounts, certain cheeses, especially aged varieties, and egg yolks from pasture-raised chickens. Western diets tend to be lower in K2 compared to diets rich in fermented foods. Supplementation typically ranges from 90 to 180 micrograms daily in studies. An important consideration: if you're taking blood-thinning medications like warfarin, you need to discuss any vitamin K supplementation with your doctor, as it can affect medication effectiveness. Your doctor may adjust your dosage or recommend avoiding K supplementation entirely depending on your specific situation. Now let's talk about implementation. Comment ready if you're going to discuss these options with your healthcare provider. First, get baseline testing. Before starting any supplement regimen, ask your doctor to check your vitamin D levels at minimum. This establishes whether you actually have a deficiency and provides a reference point for monitoring. Second, prioritize food sources. Build a diet rich in fatty fish, colorful vegetables, citrus fruits, and if you're adventurous, fermented foods. Whole foods provide vitamins alongside fiber, minerals, and beneficial plant compounds that work together. Third, if supplementing, choose quality products. Look for third-party testing certifications like USP, NSF, or Consumer Lab. This ensures the supplement contains what the label claims without harmful contaminants. Not all supplements are created equal. Fourth, be patient and realistic. Vitamins support your body's natural processes. They don't provide overnight transformation. It typically takes several weeks to months to notice any potential benefits. Monitor your symptoms. Keep regular appointments with your rheumatologist or healthcare provider, and adjust your approach based on your individual response. Finally, remember that supplements work alongside, not instead of prescribed treatments for arthritis. If you're on disease-modifying medications, don't discontinue. These vitamins potentially complement medical management but cannot replace it. The evidence we've discussed today comes from multiple research sources, and while promising, it's not definitive proof that these vitamins will help every person with arthritis. Individual responses vary based on genetics, disease type, severity, other health conditions, and medications you're taking. That's why personalized medical guidance is essential. In my next video, I'll reveal the dietary pattern that multiple studies have linked to reduced arthritis inflammation. And it's not the diet most people expect. You won't want to miss that one. To recap what we covered: vitamin D for immune modulation and inflammation control. vitamin C for collagen synthesis and antioxidant protection, and vitamin K2 for proper calcium metabolism and joint health. Each has a distinct mechanism, and together they may support your body's ability to manage arthritis more effectively when used appropriately alongside medical care. Remember, this information is educational and not personalized medical advice for your specific situation. Always discuss any supplement changes with your healthcare provider, especially given that arthritis management requires coordinated professional care. Give it a thumbs up and share it with someone managing arthritis who might benefit from this evidence-based information.